Why aren't your erections as firm as they used to be? This is the question that brings thousands of men over 50 to my office every month. You might think it's all about testosterone levels or blood circulation. And while those matter, there's a crucial piece of the puzzle that almost everyone overlooks. The reality is that weak pelvic floor muscles simply cannot trap blood inside the penis effectively, no matter how good your circulation is. I'm going to share something with you that might surprise you. Most men have never heard about pelvic floor training, yet women have been doing it for decades after childbirth. The muscles at the base of your pelvis are responsible for erectile firmness, ejaculatory control, and even urinary health. When these muscles weaken with age, everything starts to decline. But here's the good news, it's completely reversible. Today I'm going to walk you through the 5 best Kegel exercises specifically designed for men over 50. These aren't generic stretches or complicated gym routines. These are targeted movements that strengthen the exact muscles responsible for harder erections, better control, and improved bladder function. My name is Dr. Isabel Lopez, specialist in men's health, and I've helped thousands of men reclaim their confidence through these precise techniques. By the end of this video, you'll have a complete routine that takes just 5 to 10 minutes per day. You'll understand exactly which muscles to engage, how to breathe properly, and when you can expect to see real results. Follow the channel because I share evidence-based strategies like this every week. But first, you need to understand why this problem happens in the first place, and that's what we're covering next. Let me explain what's really happening inside your body as you age. Your pelvic floor is a hammock of muscles that sits at the base of your pelvis, supporting your bladder, bowel, and sexual organs. These muscles work like a valve system, contracting to trap blood in the penis during erections and relaxing to allow normal function. When they weaken, blood leaks out prematurely, firmness decreases, and control diminishes. Here's what most men don't realize. While women are taught pelvic floor exercises after pregnancy, men rarely receive this education at any point in their lives. We assume our sexual function will just work forever without maintenance. The result is that by age 50, most men have significantly weakened pelvic muscles without even knowing it. This isn't just about erections either. It affects urinary control, leading to embarrassing leaks and frequent nighttime bathroom trips. The consequences go beyond the physical symptoms. When you can't maintain firmness or you're dealing with bladder issues, your confidence takes a hit in every area of life. Many men withdraw from intimacy, avoid social situations, or resign themselves to believing this is just part of getting older. The shame and frustration can create a downward spiral that affects relationships, mental health, and overall quality of life. But here's the truth that changes everything. Targeted pelvic floor training can reverse these issues at any age. I've worked with men in their 60s, 70s, and even 80s who have regained function they thought was lost forever. Your muscles respond to training regardless of how long they've been neglected. The key is knowing exactly which exercises to do and how to perform them correctly, which is exactly what I'm about to show you. Let's start with the pelvic tilt, which you'll do lying on your back. This movement activates both your abdominal muscles and pelvic floor simultaneously, creating the coordination you need for stronger erections. Lie flat with knees bent, feet on the floor, and gently tilt your pelvis so your lower back presses into the ground. Hold for 3 seconds while consciously squeezing your pelvic floor, then release and repeat. The second exercise is the prone stretch, and you'll perform this lying face down. This position is unique because it forces your deep pelvic stabilizers to engage while lengthening tight hip flexors that restrict blood flow. Lie on your stomach, prop yourself up on your forearms, and gently press your hips into the floor while keeping your glutes relaxed. This creates a gentle stretch in your lower abdomen and pelvis while activating the deeper muscles. Now for the kneeling AB draw-in, which is incredibly effective for building endurance and control. Get on your hands and knees in a tabletop position, keeping your spine neutral. Take a deep breath in, then as you exhale, draw your belly button toward your spine while simultaneously contracting your pelvic floor. Stick with me until the end because the last 2 exercises are the most powerful ones. This combination of breathing and muscle control is what separates amateur attempts from professional results. The bridge abduction is your fourth exercise, and it's a game changer for circulation and strength under pressure. Lie on your back with a small resistance band around your thighs, just above the knees. Lift your hips into a bridge position, then push your knees outward against the band while maintaining the bridge. This simultaneously strengthens your glutes, hip abductors, and pelvic floor while improving blood flow to the entire region. The fifth and final exercise is the rocking frog stretch, which balances strength with essential flexibility. Start in a deep squat with your feet wider than shoulder width and toes pointed outward. Place your hands on the ground in front of you and gently rock forward and backward, allowing your hips to open. This releases deep tension in your pelvic floor that can restrict both blood flow and muscle function. The key here is controlling both the contraction and relaxation phases, which directly improves erectile quality and ejaculatory control. Let's talk about how to actually implement these exercises into your daily routine for maximum results. Start with 10 to 15 repetitions of each movement, or hold stretches for 20 to 30 seconds. Quality matters far more than quantity here. You need to focus on feeling the right muscles engage, coordinating your breathing properly, and maintaining good form throughout each repetition. The entire routine should take you between 5 and 10 minutes once you get the hang of it. Most men start seeing noticeable improvements within 2 to 3 weeks of consistent practice. The best times to do these exercises are either first thing in the morning or right before bed. Morning sessions energize your pelvic region for the day ahead, while evening sessions help you build awareness and control when it matters most. Here are some critical tips that will accelerate your progress. Stay well hydrated throughout the day because dehydrated tissues don't respond as well to training. Maintain proper posture during exercises. Slouching or arching your back incorrectly can shift the work to the wrong muscles. Never rush through the movements. Controlled, mindful repetitions build neuromuscular connections that rushed ones simply cannot achieve. I strongly recommend keeping a simple progress diary where you note your daily practice and any changes you notice. Track things like morning firmness, control during intimacy, and urinary symptoms. This documentation helps you stay motivated and shows you patterns you might otherwise miss. Remember, you're not just doing exercises. You're retraining your nervous system to communicate with muscles it may have ignored for decades, and that takes consistent attention. Join the members club and drop a super like if you're committed to taking control of your health, because what I'm about to tell you separates the men who get results from those who give up. These exercises aren't tricks or gimmicks. They are scientifically validated techniques that address the root cause of age-related erectile and urinary decline. When you strengthen your pelvic floor muscles, you're directly improving the mechanical function that creates and maintains erections. The benefits extend far beyond just firmer erections, though that alone would be worth the effort. You'll experience greater ejaculatory control, allowing you to last longer and enjoy intimacy more fully. Your urinary function will improve dramatically, reducing nighttime bathroom trips and eliminating embarrassing leaks. Many of my patients report decreased pelvic pain, better posture, and a profound increase in sexual confidence that transforms their relationships. Consistency and patience are your allies here. Most men see significant improvements within 2 to 3 months of daily practice. Some notice changes sooner, others take a bit longer, but everyone who sticks with the program experiences benefits. Your body wants to function properly. You just need to give it the right stimulus. Think of this as physical therapy for your sexual health, not a quick fix but a sustainable solution. I want you to share this video with any friend or family member who might benefit from this information. Subscribe to the channel because I release new evidence-based health strategies every week. Take control of your sexual health today rather than waiting for problems to worsen. Remember, it's never too late to strengthen your body and reclaim the vitality you deserve. And now you have the exact blueprint to make it happen.